I grew up here in Richmond, and I first came out in 1983 as a dyke. And I was really, a lot of the history that's been talked about here is also my history in the gay and lesbian community. I then moved out to Sacramento, California in most of the 90s, 92 to 99, and realized while I was out there that I needed to transition to be more happy as a human being. So I ended up moving back here in 99 and started my transition in about 2001, and I experienced a lot of difficulties with employment during that time, and finally ended up at the Virginia Department of Health, where I started out working for the HIV/STD hotline, which I later found out that Bill Harrison also worked at way back when, way before me. But the short story is basically that I ended up as a contract monitor for HIV prevention grants, and part of that work is in supporting trans people, helping to educate service providers about how to better serve trans people, especially because a lot of trans people are at high risk for HIV. So that's an important part of my work. And some of the early stuff that I did at Virginia Department of Health was working to do the first statewide survey on transgender health that was ever done in the United States. And some of the research from that is still coming out in papers here and there. But it was a really great experience to be a part of that. And part of the work that went into that was the community mobilization. You know, when I first moved back to Virginia, there were very few organizations that, or even support groups for trans people. I couldn't find anything in Richmond. In order to go to a support group for trans people, I had to go up to the DC area. There were no transgender clinics at that time. And so some of the work that went into doing that statewide survey also got some movement around creating the clinic that is now integrated into FAMFRE's clinic, the TG clinic that they had that started in 2004, was part of that work, and now that clinic is integrated into their regular clinic, which is great because a trans person can get appropriate health care at the FAMFRE clinic. Unfortunately, there's income requirements that prevent people who have health insurance from going there for that. So that makes it a little more complicated. But anyway, when they first started that clinic, they expected there to be only male to female trans people coming, and they were surprised that a lot of female to male folks started coming also, and they had no support group to refer anyone to, and so I got called along with a couple other folks to see if we would be willing to start a support group, and so that's the Richmond Transformers got started in 2004 as a result of that. And so that's still going on, and we still meet at FAMFRE Clinic, but it works for us. Do you want me to talk about Virginia Anti-Violence Project now, or wait?
If you talk real fast,
okay.
People will start to wander out.
I understand. Virginia Anti-Violence Project started in about 2006. We started as a project of Equality Virginia. The idea was to address and end violence that affects LGBTQ people in the state of Virginia. It would take too long to tell you a lot about it, but suffice it to say that now we have staff and we can offer services that include healthy relationships classes and also client services and a lot of other awesome stuff. And the current work that we're doing is involves a bunch of other organizations in the Richmond area, and Song is one of them, and Fan-Free Clinic is another, and GCCR Sage is another. So anyway, I just wanted to make sure that that got out there. We have a web.